Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff. We're joined tonight by Rita Espinoza, who's our Chief of Epidemiology at San Antonio Metro Health, and this is our COVID-19 update for our community. As of yesterday in Bexar County, we have now 517,067 people who have received their first dose vaccine, along with 312,544 people who are fully vaccinated. We are very thankful for those numbers going up steadily. Metro Health still has some COVID-19 vaccine appointments reserved for those who do not have access to the internet. If you don't have internet access, you can book your phone appointment by calling 311 and hitting option 8. The 311 hotline operating hours are open Monday through Friday from 8 a.m. to 5 p.m., Saturday and Sunday 8 a.m. to 12 p.m. And starting tomorrow, people over the age of 75 can go to the Alamo Dome in the afternoons to receive their COVID-19 vaccine without an appointment. We'll continue to focus our priority populations to ensure our community remains healthy. And remember, you can subscribe to our text alerts for vaccine appointments by texting vaccine or vacuna to 55000. Now to our COVID health update. Tonight we're reporting 275 new cases of COVID-19, which brings our total to 207,949. Our 7-day rolling average is at 167. Good news, our positivity rate has remained the same at 2.1%. That is the lowest positivity rate of major metropolitan areas in Texas, so we are thankful for that and for the fact that we have no new deaths to report today. But please keep in mind, many families in our community are reeling from the loss of a loved one due to COVID-19. Please continue to keep them in your prayers. There are 179 COVID-19 patients in our hospitals tonight. Over the last 24 hours, there were 23 new admissions, 72 patients in the ICU, and 30 people are on ventilators this evening. Let me turn it now to Judge Wolff.
Well, things are going the right way, but we just, shouldn't let our guard down. We still have issues ahead of us. We're keeping a careful lookout to see if this B117 variant ends up in San Antonio in any significant way. I think that's what's going through Michigan and why they're having such a large outbreak. So, just keep up what everybody's been doing. 6 foot, face mask, sanitation, keep that up. Vaccine, I think that's really where we're really striking gold, and we're all working so very, very hard on that. Our Bexar County Hospital District now has done about 278,000 of the vaccines. We'll be starting something new this week. We hope later this week to open up at St. Philip's College, and with a goal of about doing 1,000 a day there also. We got 12,000 vaccines in this week, all Pfizer. We were supposed to get another 7,000. We haven't got them yet, but if we get them by the end of the week, we'll be fine, and we're hoping that they come in because we were promised another 7,000 for that. We've got all Pfizer now. There's been some promise of J&J coming in, but we still don't have that, and we're continuing to do 6,000 or 7,000 people every day, and all people are now welcome to come and sign up and get their shots. So we just have to keep moving forward and making sure that we're getting as many shots in everybody's arms as quickly as we can to ward off any other potential danger that we may have.
All right, thank you, Judge. And we're going to continue answering questions that we receive frequently on 311 through Metro Health's hotline. And so I'm going to pose one of those questions today to Rita Espinoza. So Rita, the question is, after getting the COVID-19 vaccine, will I test positive for COVID-19 if I get tested?
So the vaccine will not cause you to test positive. None of the vaccines licensed in the U.S. or recommended in the U.S. are made out of live viruses. So it would not itself cause you to test positive on tests that are looking for the virus. So those are tests that are looking for active infection. It would not cause you to test positive.
Great. Thank you very much, Rita. Now, I do want to mention again an update on our blood supply, which also is an emergency here in San Antonio. The South Texas Blood and Tissue Center is asking for our community to schedule an appointment this week to give blood following a challenging holiday weekend that included several accidents and other traumas. The need for blood continues to remain high this week. Our hospitals have several patients with type O blood who are fighting severe blood loss, along with a full schedule of open heart surgeries and other procedures that require blood. And unfortunately, blood donations were down over the holiday weekend, and that trend continues this week with fewer donors than usual scheduled to give blood. As a result, the total blood inventory remains in the critical zone, and that's a 2-day supply. A supply of type O blood, which several of the patients I mentioned need urgently, remains extremely critical at less than a day's supply. The shortage of blood is forcing work with hospitals to evaluate which patients will receive blood transfusions. So please, please, please help us to fill some of those open appointments to give blood tomorrow or throughout this week. The South Texas Blood and Tissue Center has 6 donor rooms in the area, as well as mobile blood drives scheduled across the region. You can make an appointment by going to southtexasblood.org or scheduling an appointment through University Hospital, 210-358-2812. And again, the life you may save could be your own with that blood donation, so please schedule that appointment. Also want to remind you, if you're struggling in this pandemic paying rent or mortgage, we do have an emergency housing assistance program available for you. You can access it by calling 311 or by going to covid19.sanantonio.gov. Also, if you're out of work and without income and would like to enroll in our training program that is training for jobs available in our community today, while you receive a stipend to make ends meet, you can enroll by calling 210-224-HELP or call 311 for more information. As always, again, thank you to all of you who are doing your part to keep each and every one of us safe from this virus. Get a vaccination when you can, and also continue to wear your mask, practice social distancing and proper hygiene. Do it for yourself, do it for your family, and do it for San Antonio. Rita, myself, and the judge are available for questions.
Could you provide details on the 2 breakthrough cases reported in Bexar County in which people who had been fully vaccinated contracted COVID-19? And could you tell us details such as how long after the patients received their vaccine did they get the virus, and how severe are their cases?
Sure. So the information that we can provide is that the 2 individuals were fully vaccinated. It had been about a month or a little bit longer since that vaccine, or since they received their second dose. Both situations, they had household contacts that had confirmed cases of COVID as well. But as far as the severity, there was not a severe illness in either case.
Is there concern of a potential 4th surge of COVID cases, and how could this 4th wave look different than previous ones?
There really hasn't been a confirmed 4th wave in any location in the country right now, and we are confident that if our community continues to do what it's doing now, which is to be cautious and get vaccinated when you can, we can avert one. So I'm comfortable with the trajectory that we're on. It just will require us to stay the course and not let our guard up too fast. Again, be cautious, live your life, but be cautious as people continue to get vaccinated.
Hey, Rita, could you expand on that statement? You get the vaccine, and it's ensuring that you're not going to get sick or ensuring you're not going to get COVID.
It's really ensuring you're not going to get severe illness.
Yes,
it's going to really prevent the hospitalization and the deaths. It's not necessarily it's going to prevent all cases of COVID, but it's going to hopefully prevent severe cases and not tax our hospital systems with having individuals being hospitalized. So that's really the focus of any vaccination program, even with flu and other vaccines. I think for many years it was focused on it prevents all disease, and we've seen that that's not necessarily the case, but vaccination programs are to prevent severe illness, severe death, and hospitalizations.
Okay, that's clear.
There have been reports of India's double mutant COVID-19 variant found in California. Are teams here looking into this, and what do we know so far about this variant?
We did see, or I saw today as well, about the Indian variants. We know that the viruses mutate, and they mutate often. So it's not necessarily, I think somewhere it said it's a double variant. It just means that there was changes in multiple portions of the genetic makeup, which happens all the time with viruses. So that's very common. As far as the genotyping and the sequencing that's being done randomly on some samples, that's how we would identify those individuals, as that testing and surveillance is occurring on those specimens to do the sequencing, to see the genetic makeup of the virus, to see if it's mutated.
How important is contact tracing at this stage of the pandemic in San Antonio, and how many contact tracers do we have?
So contact tracing is still important, especially with our low numbers. It would help us, identify potentially exposed individuals, inform them of that exposure, and help them be aware and to be quarantined so that there's no further exposures or further transmission of cases. Right now, how many contact tracers we have, I don't know the exact number, but I would say about 175 total of individuals that are doing contact tracing.
With an increase in the vaccine supply of 80%, can we expect the supply to remain consistently at that level?
It's been fairly unpredictable, the vaccine allocation and distribution process, but, we do know that production has increased across all of the manufacturers. So I'm hopeful that it will remain at that level, if not increase.
Well, the 7,000 that we are promised with University Hospital, I think they will come in this week. But that's a substantial jump because we generally have about 12,000, and that would take us to 19,000, and that's a lot more shots in everybody's arms.
For the mayor and the judge, are you concerned that San Antonio's tourism industry might suffer if Texas lawmakers pass a voting bill similar to Georgia's? And what is at stake?
I am. We've already seen major events being pulled out of Georgia because of the laws that are geared towards suppressing the vote over there, and I certainly don't want that to happen in Texas.
I share your concern. As you know, Major League Baseball chose not to play there, and I don't understand it all. I mean, if we had widespread fraud or there's something terribly wrong with our election system, I could understand it, but it's not. And what's wrong with people voting by ballot? Seniors do it, and a lot of those voters are Republican as much as they are Democrat, but it protects them from having to get out and come to a polling place. I don't understand it, why it's happening. There's something like 3,300 counties across the nation, and we don't get 3,300 election administrators together to figure out how we're going to run a bad election. We all run good elections, and I don't get it. I don't get it.
That's all we have tonight. Thank you.